Good afternoon. My name is Carol Money, and this video was created for my Speech Language Pathology, Anatomy and Physiology course. I did make a 3D model of larynx. The materials I used for this 3D model include cardboard tube, foam paper, cloth, cardstock, sea glass, modeling clay, seashells, elastic hairbands, felt, and Q-tip. So we'll go over positions here. This would be anterior. This would be posterior, back here, posterior, anterior, superior, above, inferior, below. So the hyoid bone is superior to the thyroid cartilage. The thyroid cartilage is inferior to the hyoid bone. Right and left. So the trachea here is represented by a cardboard tube. It's known as your windpipe and connects your larynx to the bronchial tubes of the lungs and is the passageway for air to and from your lungs. Your tracheal rings, cartilage rings, are represented here by white foam paper. They reinforce and stabilize the trachea. They are C-shaped, not O-shaped. They do not connect in the back. The cricotracheal ligament is represented here by gold cloth. It connects the highest ring of the trachea to the cricoid cartilage. The cricoid cartilage is represented here by blue cardstock and sits at the top of your trachea. It is ring-shaped and higher in the back. I did add on to it, but imagine that crease is not there. It's this whole section. The retinoid cartilages sit on top of it, and we will get to them a little later. They're the stars of the show. The cricothyroid ligament is represented here. The cricothyroid ligament is represented here by salmon or rust-colored cloth, and it connects your cricoid cartilage to your thyroid cartilage. And it prevents the cricoid cartilage and the thyroid cartilage from moving too far apart. Your thyroid cartilage, which is represented here by cardstock and sea glass. I added some sea glass because it's a big protective barrier for your vocal folds. It's your largest cartilage in the larynx. And it has a small projection here, which makes your Adam's apple. So it comes out. You can't see it on me because I'm not a guy, but you can see that I'm in. The thyrohyoid membrane or hyothyroid membrane is represented here by mauve cloth, and it connects your thyroid cartilage to the hyoid bone, and it's responsible for upward movement of the larynx during swallowing, because as the muscles pull the hyoid bone up, there's domino effect, and it's connected and pulls it up. And then your hyoid bone here, I have it represented by modeling clay. It was sparkly. I don't know that you can see that. I made the little horns as best I could. And it is suspended. It is not attached to the thyroid cartilage. So I colored in there to make it look like there is membrane there. But I had to, for stability of this project, had to have something there. But it does not actually touch your thyroid cartilage. So it is completely suspended. It's located at the base of the tongue and is superior or above the thyroid cartilage. It's not attached to any other bones in the body and is completely suspended by muscle, ligament, and cartilage. Next, we're going to move to the epiglottis, and then we'll talk about how it's connected. But the epiglottis is represented by felt. So it is leaf-shaped, a leaf-shaped cartilage, or it has an elastic cartilage in it, and it sits upward behind the root of your tongue, and during swallowing it descends. So I didn't attach it to I didn't connect them or hot glue them because I wanted to be able to show it can go down and up. It descends down to cover the trachea opening to prevent aspiration of food or liquid. And so it is connected to the hyoid bone through this hyoepiglottic ligament, which is represented here by a Q-tip, and that ligament serves as a barrier for it serves as a barrier for the pre-epiglottic space. But so when when it shifts, I mean, obviously it shifts, so it'll be connected and pull goes with it. So and then we're gonna move inside. So it's really hard to see it, but at the bottom of your epiglottis, there's a little tiny ligament. So you have the epiglottis and then this little ligament that connects it to your thyroid cartilage. So that is represented by white foam paper. It's called the thyroepiglottic ligament. And so it connects the stem of your epiglottis with the thyroid cartilage, and it connects beneath the superior thyroid notch, which is here, and above the attachment of the ventricular ligaments, which are housed in the vestibular folds. So unfortunately, my vestibular folds, which I've made with really puffy elastic bands, it looks like they're all the same, but I think it's supposed to be just a little bit above it, from the descriptions I've read and some of the visual body animations. Of course, there's other membranes in there, so it might get hard to see that. So the ventricular folds here, I've used yellow elastic puffy soft hairband, which might not have been the best choice. I did double it up because they are larger than your true vocal fold band or true vocal folds, and they are superior to your true vocal folds. They help prevent food or drink from entering the trachea when swallowing, and from a phonation standpoint, they are utilized in special types of sound production, such as overtone singing, Tibetan throat singing, and the growly sound that is used in hard metal rock singing. So we'll move on to your true vocal folds. So it's the pink elastic band, and unfortunately this one is having some problems because when I made him, first he was too short, or it was too long, so I cut him. He had some surgery, and then he was too short, so then I had to reattach, and then it was a little bit too long again, and then I thought another surgery will do him in, so I left it. But they are under there, and they're both are connected into the arytenoid cartilages. So I got off here. So they are in a superior position to your trachea and inferior to your false vocal folds. They house your vocal ligament and are largely comprised of your thyroid arytenoid muscle, among some other structures. When they are open or abducted during inhalation, or they are open or abducted during inhalation and will close or adduct during swallowing, phonation, and the Valsalva maneuver and coughing. So open, abducted, closed, adducted. when they're adducted and airflow is initiated, they create sound, such as our singing, speaking, humming, etc. So, I did cut those, and then put them, glued them, but it's really hard to see. But actually where they join into the thyroid cartilage, where the vocal cords join into the thyroid cartilage, is known as the anterior commissure. And so that's right, it should be right below your thyroid notch on the inner surface of the apex between the laminae. You're going to have the attachments for the thyroepiglottic ligament and the vocal cords. So I added in also, just for looks, this thyroepiglottic muscle, or I tried anyway, and it's represented by blue cloth, and it has on its superior edge, it has the aryepiglottic muscle, and these work together to depress the epiglottis to close off the larynx. So that muscle pulls it down. And on the very top, you'll have the aryepiglottic fold, which manipulates your arytenoid cartilages. So now we're moving to our arytenoid cartilages. So your arytenoid cartilages, you've got your vocal folds attached in there, the vocal fold, the false vocal fold, and also that aryepiglottic fold is going to attach. And they're very special. They're pyramid shaped. They, with them through the muscles, they are able to move quite a lot. They can rock and roll, we used to say in my vocal studies, and they allow all sorts of maneuvers of the vocal folds. So they make it so you can open and close them, and you can do all of the stuff you need to do for singing anyway, and speaking as well. But they are represented here by blue cardstock, and I think that's all I need to say about them for now. They are probably sitting a little bit too far back. They're more sitting like a little bit more forward, but because of how I decided to attach them, which I would change now after after I saw the results, they're kind of sticking out a little bit more than they would. Also, grossly out of scale size are my favorite part, but they're too big for the model, are the corniculate cartilages represented by seashells. And so they sit on top of your arytenoid cartilages, and they assist with your vocal fold stability. But yes, they are way too big, and I had a glue gun mishap, and so he's really crooked. But that is my 3D larynx model, and let you see. So I would probably, if I remade it, I would probably make the thyroid cartilage quite a bit bigger, and obviously shift these in, and I might try to use something so that, it could be more mobile. It could, maybe some brads. I don't know. There would be a way I think you could make it so it was slightly mobile, so you could see some of the maneuvering of how things worked. But for a preliminary first run, that is the results. So thank you for your time, and have a great day.